Emma Visser and Anissa Quintanilla, and we chose the disease Arrhythmia. So, arrhythmias are a heart rhythm problem that occur when the electrical impulses coordinating your heartbeats don't work properly, and this will normally cause your heartbeats to be either faster or slower or just simply irregular. Heart arrhythmias may feel like a floating or racing heart and can be harmless, but some of them are bothersome and can be life-threatening even. So, as you can see in this picture, the left side is a normal heart rhythm compared to the right side, which is an irregular heart rhythm. And there are two types of arrhythmias that I will be focusing on, and that is tachycardia and bradycardia. There are several other types of arrhythmias, but those are the two that I'll be mentioning more in this presentation. And tachycardia is the one that you are diagnosed with. So here are some of the causes that you may be facing or may not be facing. There are a lot of causes for arrhythmias because well, it has to do with your heart, irregular heartbeats. So some of these include a heart attack that's occurring right now or one that has occurred and has caused scarring to your heart tissue. Changes in your heart structure, such as from cardiomyopathy, which cardiomyopathy is when your heart weakens, and therefore it makes it harder for your heart to pump the blood, which is why arrhythmia may result from it. Blocked arteries in your heart, like coronary artery disease, can also be a cause, along with high blood pressure, which often leads to diabetes. And then overactive thyroid gland and underactive thyroid gland can also be similar causes, along with sleep apnea, which is when your breathing is interrupted as you sleep, which can often cause a slow heartbeat, such as bradycardia. And then even infection with COVID-19 can also be a common cause. There are other causes that aren't listed up here, and those can include smoking, drinking too much alcohol or caffeine, drug abuse, stress and anxiety, certain medications and supplements, and even genetics. So for symptoms, arrhythmia may not even cause signs or symptoms, but there are some noticeable arrhythmia symptoms, which include fluttering in your chest or palpitations, which is just when your heart feels like it's racing or beating super fast, which leads to tachycardia, which is another symptom. And then also a slow heartbeat, also known as bradycardia, can be a symptom, along with chest pain and shortness of breath. Other symptoms can include anxiety, fatigue, lightheadedness or dizziness, sweating, and then fainting or almost fainting. Now to diagnose a heart arrhythmia, the doctor will review your symptoms and medical history and conduct a physical examination. The doctor may ask about or even test to see if you have any other conditions that may cause or trigger your arrhythmia, such as a heart disease or a problem with your thyroid gland. The doctor may also perform some heart rhythm tests for your arrhythmia, such as an ECG, stress test, an echocardiogram, a cardiac catheterization, and an electrophysiological testing, and then lastly a tilt test table. So for an ECG, you'll have sensors attached to your chest, which detects the electrical activity of your heart. You'll measure the timing and duration of the electrical pulses in your heartbeat. And the stress test is just to see if exercising on a treadmill or on a stationary bicycle will cause you to have difficulties, because that is one of the causes. And then an echocardiogram is a non-invasive test, which is a handheld device is placed on your chest, and then it produces pictures of your heart size, function, and structure. And then a cardiac catheterization may also be taken, and in this procedure, a long thin tube will be inserted in your artery or vein in your groin, neck, or arm. And this is threaded to your blood vessels and then into your heart, just to get a better picture of what's going on in your heart. And then electrophysiological testing can also be done, and this is when electrical impulses are sent through your heart, and electrodes are put on that little inserted catheter, and then once the electrodes get into your heart, they will expand depending on where your heart is pumping and how fast it's pumping. And then lastly, that tilt table test is shown in the picture. We will basically strap you onto a table, and you will be level with the floor, and from there we will monitor your heart and your nervous system reactions as that table changes angles. And then for treatment, Treatment may or may not be necessary, so these are just some of the treatments for trachycardia, which you may need to do. So those include vagal maneuvers, which some of those are holding your breath, dunking your face under cold water, or coughing. So those are just used to reset your nervous system and hopefully calm down your heartbeat a little bit. Medications like anti-arrhythmic meds can be used to restore those normal heart rhythms. And then a cardioversion can also be used to restore the normal heart rhythms by sending a shock through paddles or patches that are placed on your chest. And then a pacemaker and an ICD are very similar, but a pacemaker, those two are both very common. So pacemaker is put or inserted along your collarbone, and from there it'll make sure that your heart rhythms are normal by detecting if there are any irregularities, and then it will send a shock to your heart if it does detect any irregularities. So same thing with the ICD, except the only difference is ICD is a battery powered unit that's implanted under the skin and near the collarbone as well, but it'll send an electrode tip wire from the ICD, and then that'll run to your heart, and that's how it will detect if there are any heart irregularities. And then for prognosis and follow-up, it really depends on the type of rhythm disturbance that you have, so whether that's a slow or fast heartbeat, that'll really depend on your prognosis and your follow-up. But the outcome is usually pretty good if it is treated. Obviously, if it's not treated, it can be really life-threatening. But the availability of permanent pacemaker and implanted cardioversions, defibrillator devices, and effective medications has improved the prognosis. And then also just make those follow-up appointments to see if you are having any more issues or having any more symptoms with your doctor. And if you have any questions, you can ask me, and these are my sources.